This morning's general session will cover the evolving transplant landscape. There's quite a bit going on in the transplant arena, and that is an area that is of great interest to patients. And this morning, we're going to have several experts provide us insights from their perspective about what their organizations are involved in with respect to transplantation. Now we're going to hear from Ms. Jan Finn. Ms. Finn is president of the Association of Organ Procurement Organizations. She is also CEO of the Midwest Transplant Network. The OPOs play a very, very important role in transplantation, so we're looking forward to hearing her insights about the role that her organization plays and what is it that OPOs do that we need to be aware of. Ms. Finn?
Thank you so much for having me here today. My name is Jan Finn. I represent the Association of Organ Procurement Organizations and currently serve as their president. I'm also honored to be the president and CEO for the Midwest Transplant Network in Kansas City. So today I want to share with you a little bit about what AOPO has been doing and how we're engaging with stakeholders to improve the lives of all of those patients who are waiting for a transplant, and also the donor family situation when we are there to impact their lives in a very different way, but to continue the legacy that we are creating with saving more lives. In keeping with the collaborative theme, the questions to run on, I always like to do questions to run on, and I will answer those over the next few minutes with you. The importance of the AOPO goal. We are mission focused in all areas of donation and transplantation to save lives as healthcare providers. And we are building a system to support our mission, those missions of every OPO and every hospital and transplant center serving the communities. It's imperative that we continue to work together as a donation and transplantation system to fully develop a more collaborative system to address mechanisms which will promote quality improvement and lead to saving additional lives. Your role here today is as a committed stakeholder, and we hope that sharing these ideas with you, you'll be able to say how you could possibly be a part of saving more lives by contacting your local OPO or one of us to let us know how you could be more involved. I want to give you an example of that. I recently spoke to one of my nursing school colleagues from many years ago. Her daughter-in-law was about to be an organ donor. And last month, her entire family was so grateful for the opportunity to give others a chance. Her life-saving act was possible because of collaboration between donation and transplantation. You see, in this situation, she was COVID positive. And we learned from others that those organs too can be transplanted by reaching out beyond our normal circles, and in this case, to the Cleveland Clinic. She was able to save two lives, making a difference for 2 kidney patients that received her organs. So that's why we believe this is so important to engage with stakeholders and continue this important work. So I share with you a picture of the donation service areas across the country. We have 57 OPOs or DSAs across the country, and we all work together in this mission work. The AOPO represents 48 of the members, yet we continue to collaborate with all transplant centers and donor hospitals across these communities and work together to raise awareness in increasing the number of donors by registering as first person or actively working in the communities to engage in activities that raise awareness, and along with hospital staff, donors, donor families, all making lives better with transplantation. Just to share with you a little bit about AOPO, you may know who we are, and I want you to know we've recently revamped our mission and our vision. So we are leading the nation's organ donation community to save more lives, as I've just mentioned. Our vision is to pursue the day when every donation opportunity results in lives changed. So the U.S. system has been incredibly successful and most recently was able to surpass Spain in the number of organ donors per million population. Quite a feat when you think about this great growth that we've had and also being able to be the leader in organ donation in the world. So it's a celebratory moment for us. That doesn't come easily. It comes through much hard work And as I'll show in the next slide, organ transplantation from donation after circulatory death is one of those examples. It has been embraced by the donation community, and as you can see with this graph, grown to great heights. We continue to expand with these types of donors. Traditionally, donors are able to provide organs for transplantation through brain death criteria. Not every patient meets that criteria, but they are able to donate after circulatory death. And in these situations, we are still able to transplant organs. And so these 3,224 donors in 2020 are incredibly important in the role of increasing the number of transplants. So you might be wondering, what's the current state in 2021? As you know, COVID has impacted all of us. It has put a great strain on our hospitals, the healthcare workers, yet they remain committed to working with us as OPOs. U.S. organ donors are 8% higher as of May this year, growth over 2020, and about 50% of the organ procurement organizations are on track to increase the donors again. And half of those being at 10% or greater is such a great sign for us. We know that this goes through much work in all of the organ procurement organizations. We're excited that earlier this year, we were able to launch our goal to save more lives with the 50,000 organ transplant goal by 2026. Definitely this will be a record for us. We wanted to have a positive focus for all OPOs, including how we can get there through improvements that are already underway, such as we talked about with DCD. And we know it's an exciting time to consider possibilities and how we can continue to make a difference. But we need you. We need you as our stakeholders on this journey. The success of the donation system over the past 10 years has consistently grown in the number of transplants, and that's really remarkable. It is higher in 2020, as you just learned, which is great news for waiting recipients. We acknowledge that there's variation in performance across all OPOs. So AOPO is committed to learning what does work, what are the known best practices, and to share those broadly with others so that the performance can be improved for everyone as we move towards our 2026 goal of 50,000 transplants. It will take a concerted effort from all stakeholders to make this work. So our key initiatives: collaboration across stakeholders. AAKP, those of you involved as kidney patients, waiting recipients, and transplant patients are key to our success. We are collaborating across the donation and transplantation organizations, and this is how we will reform the system. We believe in putting a bold aim in place takes a lot of guts, let's just say, but it provides us a sense of direction and support. When we know the aim, we also know that there are improvements along the way. We need a system in place to make sure that we are able to put the interventions in place, to work with stakeholders, and just know that the day when every donation opportunity results in lives saved, we are moving closer to our vision. Much of the work today in the world is centered on the equity issues, so DEI is really important and certainly a focus for us. We want to reduce disparities, especially in transplantation. We know that Blacks are 3 times more likely to need a kidney transplant. Native Americans are 4 times more likely, and Asian Americans are 4 times more likely to develop hepatocellular cancer, one of the key indicators for liver transplantation. The median days is definitely longer for these groups in the time that they're waiting for organs. So what we want to do is to make sure in our efforts that we dispel any myths that OPOs are implicitly biased, that there are any situations where we do not respond to potential donors, or our response times are flawed, our interactions and engagement are not up to par. We stand ready to demonstrate how we perform to save lives and engage with others in a transparent manner. AOPO must be the part of education on all of these issues and training to improve processes. Every AOPO member and OPO is asked to perform a DEI assessment on their own organizations to position themselves to learn how to close gaps, and we want to provide resources to each of the OPOs in order to make sure that we are addressing the health equity issues. So who are our stakeholders? I love this picture because it really means that we are engaging with so many wonderful people out there. Some of those key stakeholders are listed here. So AAKP, serving kidney patients across the education avenues, the advocacy avenues, since 1969 is the independent voice for kidney patients. You are helping those patients live better and live longer. And you can see there are many associations here that we work with on a regular basis, whether they be patient advocacy groups, transplant hospitals, the American Hospital Association, certainly CMS and the end-stage renal disease networks across the country. We also work very closely with donor families to learn from them how we can do better for all recipients. And it's always what we are doing to work towards reducing the number of people on the waiting list. As we know currently that kidney transplants not only save lives, they extend lives, they make possible many memories that would not be possible without a better life or better chance with a transplant. So we intend to expand our collaboration. And by this, I mean that we want to learn from others. It's often said, you don't know what you don't know. And in AOPO, partnering, as I mentioned earlier, with all of the associations, professional societies, we can learn the advocacy efforts that they are working on, coordination of activities, or discussing joint ventures. The Kidney Collaborative is one of those joint initiatives. We will be building on what has happened previously with collaboratives. Many of you may remember the HRSA collaboratives from before, and we were able to make great strides in increasing the number of organs for transplantation. With this kidney collaborative, we will also be working on decreasing the number of unused donated kidneys. So several OPOs recently published a paper that I might want to call your attention to, the Wyman Report, and there were many outlined initiatives there to help decrease kidney discards in particular. Those are the types of things that we talk about in collaboration with other OPOs so that we can put these on the table for example, maybe a PDSA or a trial to see what would this do to help increase the number of kidneys. We want to get to 28,310 kidney transplants in 2026, which is a 61% increase from where we were in 2020. That will take continued growth. It will take continued progress, as we've talked about with DCD, but some of the other initiatives I want to share with you. One of those being data sharing. As I mentioned best practices earlier, OPOs learn from each other. We learn from testing strategies and examining the data, and learning is really vital. So AOPO is committed to data gathering on key elements and sharing those broadly in a manner which possibly would be de-identified to protect the OPOs. However, we want to do it in full swing together, and we have a data definitions task force that is ready to move forward. We operate in an all teach, all learn environment, and the OPOs are accustomed to reaching out to others to see what they are doing and to implement similar things. Such things that have been implemented in the past are DCD donation programs. That really started during the first collaborative. We also want to learn from transplant centers. What are they doing so that they are getting more patients transplanted? When we have data, not only on OPOs, but on transplant centers, we're able to reach out and learn from them and be able to utilize those things to move forward to save more lives. So let's talk a little bit about some of these key strategies. We want to increase donation authorization, increasing donation in multicultural communities, obviously encouraging donor designation through first-person registries, enhancing the family donation discussions, and definitely facilitating first-person authorization. Across the country, we've experienced as OPOs some opposition to first-person authorized donation. It is our responsibility as OPOs to work collaboratively with the hospitals, to share with them how this can work, and definitely to honor the gifts that were designated by the person. So those are just a couple of ideas and strategies that we will be working on and currently are to improve in all these areas. So advocacy is something that I think is really important in the work that we're doing. It is one of our pillars to continue to educate our elected officials. And it's not really about trying to change anything or to advocate against something. It's really to provide education, and specifically on things that we believe are important, our donation message, promotion of donation. And we know that some of the effective communication that needs to happen happens through repeated messages. So often we're telling the same types of stories. We are offering a message of hope and for our life-saving work. The dedication from all of us in donation and transplantation is to improve opportunities for recipients to create legacies. So we listen to elected officials. We also are educating them in the process, but it's about this positive focus on the success of the system and to explore new opportunities. So in continuing to think about advocacy, I mentioned earlier that we want to talk more about known best practices. I mentioned some of those things with our DEI initiatives and also fairness in donation and the allocation of organs across the country. But one of the things that AOPO can definitely help with is to advocate to OPOs for what is best. Some OPOs, as I will tell you, the country is very different. You saw on the slide earlier, some serve smaller areas and may have limited resources, but together through AOPO, we are advocating in how we can better serve more diverse populations. We can ask those types of populations to share their experience and how we can integrate across all the underserved. It also means advocating across various social media platforms to share our educational messages, but also more about how donation and transplantation really works. So a couple of other things just to mention. In terms of accountability, we are focused on how to work within the system to utilize more of the recovered organs. I mentioned earlier that this is definitely a challenge when we're talking about utilization of organs from older donors, DCD donors, or more complex donors. We need to work more collaboratively with smaller transplant programs and large programs to understand how we can ensure that these organs that they are selecting is the right organ for the right recipient. We are working through these complex situations on a daily basis in the organ procurement organizations. So we are constantly learning and implementing new things. One thing that is of importance, I mentioned earlier about COVID positive donors. Prior to 2020, that wasn't even a question, but now we've learned ways that those organs can be successfully transplanted. The same is true for hepatitis C positive organs. When we talk about challenging cases, more complex areas, and even the acceptance of DCD organs, we know that we will learn the most from those that are doing that work. So studying the best practices of transplant centers. If you have anything to share with that, an innovative practice or initiative that you've been involved in, shoot me an email because we want to learn from you, from our transplant partners, and certainly other OPO partners and how to partner together for better performance. One such example that I can tell you about in recent years with innovation, I think is really important to consider organ perfusion. Transplant programs are successfully using DCD hearts with the aid of machine preservation. There's an OPO in San Diego that has coordinated 10 such donations this year. And that means 10 people received a heart transplant that previous to this innovation would not been able to do that. I mentioned earlier the COVID positive donors that we've had here in the Midwest. We would not be able to do that without a transplant partner in Cleveland to be able to say these organs will work. So while technology may drive many new therapies, it is also an innovative spirit and collaboration to consider how organs can be utilized. This work really goes hand in hand with all the things we're doing when we talk about advocating to inform elected officials about the good things that are happening. One of those would be partnering with hospitals for electronic referrals so that we can streamline the process to allow earlier intervention on particular donor cases and to support the donor hospitals and families, all in an effort to save more lives. All of these things are working comfortably together, and many areas that we know we will continue to expand upon throughout the coming years, and definitely moving towards 2026 when we get to our 50,000 goal. 50,000 lives saved by transplantation is an incredible way for us to focus. Thank you so much today. I really appreciate you being a part of this, and I hope that you're excited about what AOPO is doing. Certainly, you know that we have great initiatives in process, and it's all focused on saving more lives. So we hope that you'll go along this journey with us. We need you, and certainly you have my contact information in case you need me. So go out and do something great today, and let's make more lives happen through donation and transplantation.
Dr. Snyder, Dr. Ratner, Ms. Finn, we appreciate the opportunities and the insights that you have provided us with respect to what's going on in the transplantation arena. And we will certainly use this information again to educate our patients so that they're in a better position to pursue a transplant. Thank you very much. Have a great day.